COVID, the medi-crime and the medi-boom. The frenzied dance of virus as part of its second appearance continues unabated. The authorities are struggling to cope up with ever-increasing demands of healthcare management. Thanks to aids and help from across the country, the shortage of oxygen and vaccines are slowly getting addressed. The entire system is running post-pillar 24/7 to contain the spread and rescue the infected. But some are fishing in troubled waters. It's the private healthcare sector management which is looting the COVID-19 patients mainly. This is the most unfortunate part of COVID-19 episode, which is into the second year now. The private hospitals continue to exploit the patients and manipulate the pandemic. They charge the virus infected exorbitantly. Obviously, few aggrieved persons approached the High Court of Kerala against the inhumane act. The court expressed its serious concern over the issue. It also instructed the government to ensure that no patient is charged exorbitant. The court directed the government to discuss the issue with private hospitals and arrive at an affordable and uniform rate for COVID-19 treatment across the state. The hospitals were charging huge amounts on PPE kits and medicines. But the fact is that they charge for PPE kits from all the patients while one nurse uses one kit for attending about 100 patients. A Kochi resident was charged about 40,000 rupees for PPE kits alone for his 10-day long admission. His total bill touched ₹1.5 lakh. There have been complaints of this sort last year also. In fact, the government had then fixed rates for COVID treatment for private hospitals. But they were seldom followed then. However, the issue faded away as the virus menace was almost forgotten during the election days. But with the next wave with a more vigorous impact has given the private hospitals a lucrative business opportunity. Coupled with its unreasonable rates for nursing and PPE kits came the shortage of oxygen. This gifted the hospitals yet another opportunity to loot the patients. Now, having pulled up by the High Court, let's hope that such looting would end. The denial of hospitals to release bodies of dead COVID patients has also been in news in some parts of the state. But the district authorities are taking serious concern over this. The district collector of Thiruvananthapuram had warned the hospitals in the district. The collector Navjot Ghosha had issued a show cause notice to Nayar Medicity. The hospital, which billed 4.4 lakh rupees for treating the man, refused to mend even after officials intervened. But the collector acted strong, saying it is inhumane that hospitals are not releasing dead bodies for money. She ordered immediate release of the body without waiting for payment of bills. She cautioned that such hospitals will be booked under Disaster Management Act. It was a welcome move that the government had cut the cost of RT-PCR tests from rupees 1,700 to 500 rupees recently. In a significant directive from the central health authorities, the hospitals have been advised to admit those who approach with serious health issues. A positive COVID-19 test report is not mandatory for admission to a health facility, be it government or private, the directive said. Things are getting streamlined even as the vaccination drive is slowly but steadily progressing. A spectacular achievement by the Defense Research and Development Organization DRDO is likely to change the entire scenario. The medicine developed by the Institute of Nuclear Medicine and Allied Sciences of the DRDO will be a game changer. The drug 2-Deoxy-D-Glucose 2-DG is developed in collaboration with Dr. Reddy's lab and has been approved by the Drugs Controller General of India DCGI. The drug is found to recover hospitalized patients and reduce supplemental oxygen dependence. Moreover, the drug is in powder form and can be taken orally by dissolving it in water. The production is fast progressing and will be available for use in a month's time, if not less. Now, things will be different possibly from June with the DRDO drug bringing down the number of infected patients. There is light seen at the end of the COVID-19 tunnel. Let's keep our fingers crossed. Please subscribe the channel. Also, click the bell button to get the latest updates.